Hello everyone. We are proud to present about the cancer that significant impact on the quality of life and emotional well-being. And it is one of the most common urinary neoplasm in the industrialized country. This cancer is bladder cancer. About the bladder. The bladder is an expandable hollow organ that stores urine before it leaves the body during urination. This function makes the bladder an important part of the urinary tract. The bladder is lined with a layer of cells called the urothelium. This layer of cells is separated from the bladder wall muscle, called the muscularis propria, by a thin fibrous band called the lamina propria. About the bladder cancer. Bladder cancer begins when healthy skin cells in the bladder line change and grow uncontrollably, forming a mass called a tumor. A tumor can be cancerous or benign. A cancerous tumor is malignant, meaning it can grow and spread to the part of the body. A benign tumor, that means the tumor can grow without not spread. Type of bladder cancer. The type of bladder cancer depends on the type of cell in the layer tissue affected. The three main types of bladder cancer are: first, urothelial carcinoma. It begins in the urothelial cell. It was previously called transitional cell carcinoma or TCC. This cell forms the innermost layer, the bladder, allowing the bladder to stretch when it's full and shrink when it's empty. Second, squamous cell carcinoma. Squamous cells develop in the bladder lining in response to irritation and inflammation. Over time, this cell may become cancerous. Squamous cell carcinoma accounts for about 4% of the bladder cancer. Third, adenocarcinoma. This type accounts for about 2% of all bladder cancer and develops from granular cells. There are other less common types of bladder cancer, including sarcoma that begin in the fat or muscle layer of the bladder, and small cell anaplastic cancer that is likely to spread to other parts of the body. In addition to its cell type, bladder cancer may be described as non-invasive, non-muscle invasive, or muscle invasive. First, non-invasive. This type of bladder cancer usually does not extend to the lamina propria. Second, non-muscle invasive. Bladder cancer typically has only grown into the lamina propria. Third, muscle invasive. Bladder cancer has grown into the bladder wall, muscle, and sometimes into the fatty layer or surrounding tissue outside the bladder. It is important to note that both non-invasive and non-muscle invasive bladder cancer have the possibility of spreading into the bladder muscle or to the other part of the body through a process known as metastasis.
Bladder cancer stage. Bladder cancer stage, including TNM system for bladder cancer. The TNM system was developed by the American Joint Committee on Cancer Consideration the site and location. Tumor RT, the site of the original tumor, including it has grown to the bladder wall or invaded nearby tissues. Note RN, the cancer is present in the lymph nodes. Metastasis RM, the cancer has spread to other parts of the body. This is the picture of the TNM system for bladder cancer. Stage 0 of the bladder cancer. Stage 0 of the bladder cancer. Stage 0A, also known as non-invasive papillary carcinoma. Stage 0 is also known as carcinoma in situ or flat tumor. Abnormal cells that may lead to cancer are present in only the epithelial layer of the bladder lining. Stage 1 of the bladder cancer. Stage 1 of the bladder cancer. Cancer cells are confined to the bladder, but tumor has grown to the epithelial bladder lining and into the lamina propria. Stage 2 of the bladder cancer. Stage 2. Cancer cells are confined to the bladder, but the tumor has grown to the first two layers of the bladder lining and into the muscularis propria. Stage 3 of the bladder cancer. Stage 3. The tumor has spread to the outermost layer of the bladder, or it has grown to the layer and may also have spread to the prostate in men, or to the ureter or vagina in women. Stage 4 of the bladder cancer. Stage 4. The tumor may be any size, but may have spread to the pelvic or abdominal walls. Cancer cells have likely spread to one or more original lymph nodes and may have spread to the outer parts of the body. Signs and symptoms of the bladder cancers. The first sign is blood in the urine. Blood in the urine is the first sign of the bladder cancers. Is usually blood in the urine, also called hematuria. The color of the urine may change to a very pale yellow red. More rarely, the urine may be dark red. Second, changes in the urination. Changes in the urination is not full maybe bladder cancer symptoms, but it is important to recognize that these changes are more commonly a sign of a less serious condition, such as a benign tumor or an infection. Third, lower back pain. Larger bladder cancers may cause lower back pain.
Risk factors. There are many factors that increase the risk of bladder cancer, both external and internal factors, and we will present only the important factor. The first factor is genetic factor. The first one is genetic change. This occurs in oncogenes, ponto-oncogenes, tumor suppressor genes, regions of microsatellite and cell cycle regulatory genes that increase in the mutation rate. This divides into two types. The first type is the insertion or deletion basic single nucleotide change that result in read errors and are often observed in microsatellite regions. The second type comprises the loss or gain of whole chromosomes or chromosome fragments, resulting in the loss or amplification of regions of DNA. The most frequent changes are polysomy of chromosome 3, 7, and 17, and monosomy of chromosome 9, but have been observations that 100% of patients with chromosome 17 loss exhibit recurrence that the oncogenes RAS related to. The second tool is signaling pathway. There are two major signaling pathways related to. The first one is abnormal activation of the fibroblast growth factor receptor 3 genes, or FGFR3, where either overexpression or mutation is cited in about 80% of non-invasive bladder cancer tumors. FGFR3 and many other growth factor receptors participate in the activation of the RAS kinase signaling pathway, thus leading to increased cell proliferation, motility, and cancer transformation through hyperplasia of normal urothelium. The second major pathway related to bladder cancer progression, that is P53 pathway, is misregulated in muscle-invasive tumors that mainly contain mutations in P53 genes. Aberration of P53 in the signaling pathway leads to the development of carcinoma in situ, invasive carcinoma, and metastasis through urothelial dysplasia. The second one is age. The likelihood of being diagnosed with bladder cancer increases with age. More than 70% of people with bladder cancer are older than 55 years old. The average age at diagnosis is 73. The third is drinking.
Drinking plenty of fluid daily can diminish your bladder cancer risk. Likewise, not drinking enough may increase risk because the chemicals are left in the bladder longer if drinking water contains arsenic. It has been linked to the bladder cancer. The fourth is smoking. Smoking is the greatest risk factor for bladder cancer. Inhalation brings the chemical in cigarette out of the lung and into the bloodstream. Then they are filtered out of the blood by the kidney and end up in the urine. And the carcinogen, like a group of alanine present in the fluid, can damage the cells of the bladder wall, increasing the risk of cancer developing. The fifth is chemical exposure. Having the chemical used in the industry so much which has carcinogens such as alanines, benzene, aldehydes, beta-naphthylamine, and polycyclic aromatic hydrocarbons include rubber, plastic, leather, textile, paint manufacturing, and painting, including the jobs that are mechanics, miners, hairdressers that export hair dye, and the driver. Diagnosis. The first test of your first appointment is cystoscopy because it's done quickly. The doctor will squeeze some anesthetic jelly into your urethra. It may mean jelly down the penis. Then the doctor will put a cystoscope tube or cystoscope into your bladder and move it around to examine the inside. If anything looks abnormal inside your bladder, doctor wants to take tissue samples that are biopsied. Biopsy. Biopsy is the best way to diagnose cancer that are usually done during a cystoscopy by using thin instrument inserted through the cystoscopy tube and collecting a small sample of tissue that appear possible cancerous from the inside and sent to a pathologist to inspect later. Urine lab test. The doctor tests a urine sample to find out if it contains tumor cells. Undergoing a cystoscopy, having collecting the liquid through the cystoscope that is inserted into the urethra. The most common test way is to look at the cell under a microscope, called urinary cytology. Computed tomography, CT or CAT scan. A CT of the bladder, ureters, and the kidneys is called a CT urogram. This can also help locate any enlarged lymph nodes and give useful information about the abdominal and pelvic regions by three-dimensional picture with an X-ray machine that shows abnormalities or tumor and size. Magnetic resonance imaging or MRI. MRI urogram is more sensitive than CT scanning and have the added benefit of detecting a large lymph node near the tumors, which can suggest that a cancer has spread metastasized to the lymph nodes or nearby tissues. Intravenous urogram or IVU. It is a general X-ray examination to look at the whole of your urinary system by using dye injected into the vein to outline specific areas that are the kidneys, bladder, and ureters. This tests you to see what is causing your symptoms. Ultrasound. Ultrasound can also be used to precisely locate the position and determine the size of a tumor in order to guide a biopsy or aspiration procedure by not using high-frequency sound waves. The last diagnosis is pathology. The pathologist will examine a small sample tissue that is a biopsy under a microscope and identify the type of tumor and is it benign or malignant. This is essential because the different types have very different treatment regimens.
Bladder cancer treatment. There are 4 bladder cancer treatments. First, surgery consists of transurethral bladder tumor resection or TURBT, cystectomy, urinary diversion, Second, chemotherapy consists of intravesical chemotherapy and systemic chemotherapy. Third, immunotherapy. And fourth, radiation therapy. Transrectal bladder tumor resection or TURBT. This procedure is used for diagnosis and staging, as well as treatment. During TURBT, a surgeon inserts a cystoscope through the urethra into the bladder. The surgeon then removes the tumor using a tool with a small wide loop, a laser, or flocculation. The patient is given medication to block the awareness of pain, known as an anesthetic, before the procedure begins. Cystectomy is the removal of the whole bladder and possibly nearby tissue and organ. For men, the prostate and urethra also may be removed. For women, the uterus, fallopian tubes, ovaries, and part of the vagina may be removed. For some specific cancers, it may be appropriate to remove only part of the bladder, which is called partial cystectomy. Urinary diversion. If the bladder is removed, the doctor will create a new way to pass urine out of the body. One way to do this is to use a section of the small intestine or colon to divert urine to a stoma or ostomy on the outside of the body. The patient then must wear a bag attached to the stoma to collect and drain urine. Intravesical chemotherapy is usually given by a urologist. During this type of therapy, drugs are delivered into the bladder through a catheter that has been inserted to the urethra. Local treatment only destroys superficial tumor cells that come in contact with the solution. It cannot reach tumor cells in the bladder wall or tumor cells that have spread to the other organ. Systemic chemotherapy is usually prescribed by a medical oncologist, a doctor who specializes in treating cancers with medication. Systemic chemotherapy gets into the bloodstream to lead cancer cells throughout the body. Common ways to give chemotherapy include an intravenous tube placed into a vein using a needle or in a pill or capsule that is swallowed. Immunotherapy, also called biologic therapy, is designed to boost the body's natural defense to fight the cancer. It uses materials made either by the body or in a laboratory to improve, target, or restore immune system function. The standard immunotherapy drug for bladder cancer is a weakened bacterium called Bacillus calmette-guerin, which is similar to the bacterium that causes tuberculosis. BCG is placed directly into the bladder through a catheter. BCG attached to the inside lining of the bladder and stimulates the immune system to destroy the tumor. Radiation therapy is the use of high-energy X-ray or other particles to destroy cancer cells. The most common type of radiation treatment is called external beam radiation therapy, which is radiation therapy given from a machine outside the body. Radiation therapy and chemotherapy may be used to treat cancer that is located only in the bladder, for destroying any cancer cell that may remain after TURBT, to avoid removing all or part of the bladder.